So this is the Sensory System A&P lecture. I want to encourage you to subscribe so you can receive notifications of when all the videos become uploaded. And also like and comment if you find this video helpful. So here we go. Receptors and sensation. So sensory neurons transmit information to the central nervous system. And a receptor is a specialized area of sensory neuron that detects a specific stimulus. So we have 5 types of sensory receptors. We have chemoreceptors. These are stimulated by changes in chemicals such as hydrogen, calcium, and food. We have pain receptors called nociceptors. They're stimulated by tissue damage or distension. Thermoreceptors are stimulated by changes in temperature. Mechanoreceptors are stimulated by changes in pressure or movements. And photoreceptors are stimulated by light. So we have sensation and perception. So sensation is the conscious or unconscious awareness of incoming sensory information. Perception refers to conscious awareness of a sensation. So the book tells you, for example, yelling, "Ouch, that knife is sharp," indicates that you have become aware of a painful stimulus and what caused it. So when experiencing a sensation, there are 4 components. You have the stimulus, receptor, sensory nerve, and special area of the brain. I'm going to zoom in so you can take a look at this picture. As you can see, you have your stimulus, your receptor, your sensory nerve, and the part of the brain. So characteristics of sensation. So there's 2 characteristics. We have projection and adaptation. So for projection, this is the process whereby the brain, after receiving a sensation, refers the sensation back to its source. So for example, you have phantom limb pain, and this is where the severed nerve endings continue to send sensory information to the parietal lobe of the brain. So even though the lower leg is amputated, the nerve endings are still sending those signals. So that's why the patient says, "Oh, I still feel like my foot is there." Adaptation. So when continuously stimulated, these receptors send fewer signals to the areas of the brain that interpret sensory information as smell. So for example, when you go into a room with a strong odor, the odor is overwhelming at first, but after a short time, the odor becomes less notable. So the sensory receptors have adapted. And there's a little cartoon there. If you can smell yourself, others have been able to for a while, because your sensory receptors have adapted to that smell. Okay, so your general senses. General senses are called general or somatic because their receptors are widely distributed throughout the body. And we have 5 of those general senses. They include pain, touch, pressure, temperature, and proprioception. So let's talk about pain. Pain is called nociceptors and consists of free nerve endings that are stimulated by tissue damage. Pain receptors do not adapt and may continue to send signals after the stimulus is removed. So pain serves as a protective function because it motivates the person to remove the cause. And some patients are at risk of a diminishment or alteration in sensation of pain. So for example, your diabetic patient, they're going to experience diabetic neuropathy, and this is where they develop nerve damage and don't feel when they step on something, or they may not feel a wound to the foot. So what causes pain? Pain has 3 triggers. Number 1 is tissue injury. Number 2 is a deficiency in oxygen, such as in ischemia. So that's for like the pain of a heart attack. And number 3, when tissues are stretched or deformed. So for example, if you have distended intestines, you're going to feel some severe cramping. So we have what's called referred pain. And this is when pain feels as if it's coming from an area other than the site where it originates. And so for example, patients with heart disease, they often complain of pain that starts in the shoulder region and moves down to the left arm into the fourth and fifth fingers. So as you can see, so they would be having some chest pain here, and they would start feeling it in the shoulder, and it's going to come down and it's going to go into their fingers. So these are your sites for referred pain. So that just means that it could be coming from your chest, it could be coming from a different area, but you're going to feel it in different parts of the body. So touch and pressure. So the receptors for touch and pressure are mechanoreceptors. They respond to forces that press or move or deform tissue. And touch receptors are also called tactile receptors and are found mostly in the skin. Touch is the first sensory system to develop in the fetus and is essential to its growth and development. So if an infant is not touched, it does not thrive and it will likely die. And this is called the failure to thrive syndrome. So an appreciation of touch in the health of a preterm infant forms the basis of what's called Kangaroo Care. And this is where the tiny diaper-clad infant is placed in the blouse or shirt of its parents. And the warmth and physical contact with the parent causes many neurological changes that calm the infant, stabilize temperature, and improve feeding. Temperature. So the receptors for temperature are called thermoreceptors, and the two types are heat and cold. Both heat and cold thermoreceptors display adaptation so that the sensation of heat or cold fades rapidly. Proprioception. This is the sense of orientation or position. So this sense allows you to locate a body part without looking at it. So the receptors for proprioception are called proprioceptors, and they are located in muscles, tendons, and joints. Proprioceptors are also found in the inner ear, where they function in balance or what we call equilibrium. So now let's rethink. What are the 5 types of sensory receptors? I'll give you a second to say it out loud. Okay, chemoreceptors, nociceptors, thermoreceptors, mechanoreceptors, and photoreceptors. Let's rethink. Give an example of projection and adaptation. Phantom limb pain is an example of projection, and smelling is an example of adaptation. Let's rethink. What are the 3 triggers for pain? Tissue injury, a deficiency of oxygen, and stretched or deformed tissues. Let's rethink. What is referred pain? Referred pain is when pain feels as if it is coming from an area other than the site where it originates. Let's rethink. What is the name of the syndrome that occurs when an infant is not touched? Failure to thrive syndrome. Good job. So we're going to go ahead and go on to the sense of smell. So the sense of smell, olfaction, is associated with sensory structures located in the upper nose. The olfactory receptors are very sensitive and classified as chemoreceptors. And these sensory receptors travel along the olfactory nerve, which is cranial nerve number 1. So you have aromatherapy, which uses the sense of smell for its healing and calming effects. You have pheromones, which are sex odors, and they are for mating and reproduction. Your sense of smell can tell you things such as ammonia fumes that activate both the olfactory and trigeminal nociceptors. Thus, smelling salts quickly and uncomfortably revive a semi-conscious person. Putrid odors can stimulate the emetic center, causing the person to vomit in response to the noxious stimulus. And some persons experience an olfactory aura, meaning that they smell an odor that is not present. So such as flowers, or maybe they smell something sweet or something salty. So these most likely occur before seizure or migraine. So you want to pay attention if your patient is telling you that they smell something or they feel like they're about to have a seizure or a migraine. And your sense of smell is also a valuable diagnostic tool. So you can smell the acetone breath of a person in diabetic ketoacidosis. So sense of taste, let's talk about the tongue. So the sense of taste is often called the social sense, as in let's do lunch. It is also called the gustatory sense or gustation. And so the taste buds are located primarily on the tongue, and you have sweet, salty, sour, and bitter. So the taste impulses travel along 3 cranial nerves, and those are facial, glossopharyngeal, and the vagus nerve. So your sense of taste in pregnant women, they usually crave salt. So they have a taste for something salty. And this can be indicative of a decreased amount of sodium in the blood. Taste receptors are especially sensitive to bitter. Food tastes different when you have a cold because information from both senses of taste and smell, they may combine to produce a different taste sensation. And then the sense of taste can be lost or altered. So for example, drugs and radiation and chemotherapy, they often change or destroy the sensation of taste. So let's rethink. What is the name of the receptors for the sense of smell? Olfactory receptors. So I like to remember this by thinking of when I pass by the old spaghetti factory, olfactory, it smells good. Let's rethink. What is the name of the receptors responsible for a sense of taste? Gustation or gustatory. And I remember this by thinking of, I have a taste for Gus Junior's for lunch. So that's gonna help me remember that gus and gustation is for lunch. It's for your taste sensation. Okay, so we're gonna go on to part number 2. Go ahead and click on the next video and I'll meet you over there. Anatomy of the sensory system, part 2.